In this episode of Ask the Doc, I got a great question from Julie on Facebook that said, what do you do when you slip a disc or you throw your back out, and what causes it? What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road like pain pills, injections, and surgeries, which only make things worse. Back at it for Ask the Doc. And this episode came from Facebook from Julie. I'm going to read the full question. I have been dealing with off and on back spasms from an injury 10 years ago when I slipped a disc in my lower back. Sometimes the spasms aren't too bad and go away in a day or two. Other times they are awful and last for a few weeks. Why do I continue to get these spasms, and what can I do when they happen to get rid of them sooner? My last episode was really bad, and it didn't get any better like it used to in the past with massage and chiropractic work. I hate the feeling of my back being unstable and going out, not to mention how much time I miss from work and helping take care of my kids. Thank you so much for sharing that, Julie, and sorry to hear you're going through this, but a lot of people suffer with back problems that are completely misdiagnosed or not even diagnosed correctly, just having to deal with this and suffer, and it just shouldn't happen like this. This video really comes at an opportune time as well. I myself have been dealing with a low back flare-up for going on about a month now. My history is, I played a lot of football in college, blew out some discs in my back, and this happens as well, and I understand what you're going through. It sucks when you have back pain. It takes away all your focus, all your attention. You can't do the things that you want to do, and it seems like it's never going to go away. And if you're younger, I'm only 37 with this, I start thinking a little bit more into the future of like, how bad is this going to be when I get older? I know how much it can really mess with you, and I totally understand where you're coming from. So the first thing we have to understand is when you hear terms like back spasms or I slipped a disc, that isn't what's really happening. So what I want to include first in this video is a breakdown of what happens when your back locks up or it feels like your disc is slipping, or you just feel like you have this excruciating back pain. And I want to explain exactly what's going on, because if we know what the problem is, then we'll be able to fix it. So I'm going to link that video up right now. Hey everyone, this is our educational video for today. What I wanted to talk about was something that is vastly misunderstood and very common to people, is actually what's called back spasms.
Doctor said I need a backiotomy.
If you're one of the unfortunate people who have had back spasms in the past, you know what it's like. It comes out of nowhere and it can really cripple you and leave you incapacitated for a long time. What I wanted to talk about today was why this back spasm happens. So we got a fancy diagram in here. So basically what I wanted to draw first was a segment of your vertebrae or your spine. Up here are what's called the vertebrae, and in between is called the disc. The disc is a really good shock absorber. It's designed to handle force like this all day long, and that's what it's really good at. What I drew over here was some muscles. Muscles in your back, their job is to support and cushion your spine and allow it to have stability. Over time, with sitting, bad postures, overwork, just everything, these muscles get overworked and they develop this stuff that's called adhesion. It's like glue that gets inside the muscle, and when you have adhesion, it makes the muscles weaker and less flexible. It's also the most common cause for those problems, which is bad enough, but what happens is the muscles are actually supposed to support your disc and your bones, and they can't. Now what happens is your disc starts to slide and grind on itself. When that happens and we cut this open, the inside of your disc looks like the inside of a tree. In the middle is what's called the nucleus. It's a toothpaste-like substance, and around here are these rings or ligaments, and it wants to stay nice and compacted and compressed. It doesn't want to slide and grind on itself, but when you have all this soft tissue dysfunction, it puts more pressure in here. So what happens over time is you start to get some tearing in through here. That's when your back feels tight or feels uncomfortable, but over time, this toothpaste or this nucleus starts to come out. When that happens, your body goes on lockdown. Everything tightens up, it seizes up. That spasm is actually happening for a reason, because it's trying to protect your low back and protect your disc from getting any worse. So if you've ever had a spasm and you feel like you're crooked, it's because your body is trying to take pressure off of that and keeping that from getting worse. So what happens is when people get back spasms, they panic. They freak out. They go to the emergency room. They go and see the chiropractor right away. They try to stretch it. They try to roll it out. The problem is that spasm is happening for a reason. It's almost like when you sprain your ankle, you start to limp to take the pressure off of there. So steps. When you flare your back up, you feel like your back just went out, or you slip that dreaded disc, number one is don't panic. When people get pain, excruciating pain, we panic and we start to freak the hell out, and we end up in the emergency room at the doctor's office getting all these tests and everything done. Understand, when you're getting your pain, the body is trying to tell you that something is up and you need to listen. So don't panic when you first get that short burst of like acute, awful pain. Understand that you need to just slow down and listen to your body because it's trying to tell you something. Number two, don't try to stretch it out. I know when it's tight and it's spasming, you just want to like stretch it, roll it out, jam a lacrosse ball in there, go on a foam roller, do whatever you can to get rid of that pain. But that pain is there for a reason. It's trying to tell you something. Think of this pain as like pain from a cavity in your tooth, and you get all that pain in there. You wouldn't go in there and like jam a toothbrush and some floss and brush really hard in there. It's just going to make it angry and piss it off. This is what's happening when you try to stretch it, you roll it, or jam something in there. You just got to let it kind of just chill out for a little bit. Number three, and this is going to be the hard one, no treatment whatsoever for at least 7 to 10 days, preferably 7, even as far as 10 days. What we need to do is we need to let that tissue settle down. When you're getting those spasms and things are tightening up, what it's doing is it's trying to protect you and protect that disc from getting overloaded. And when you go to the chiro, you go to the massage, you get some work done, what you're doing is you're temporarily allowing those muscles to relax, but then it jams right back down in there as well. So really just letting the first 7 days, let the body do its thing, let it have inflammation. It's going to be angry at you, but if you try to get rid of the pain too soon, you're going to have to deal with it bigger down the road. Number 4, you just got to keep moving. I know it sucks. I remember the last couple weeks when I'd get up in the morning, I could barely stand up straight and had to crawl out of bed. But once you get moving, you start getting things pumping, the blood pumping, your body is going to feel better. Yeah, that first 30, 40 minutes is going to suck, but if you do that work in the front end of the day, early in the morning, you're not going to feel as bad throughout the day. So you got to keep moving. You don't have to go out and run a marathon, but maybe try to walk, 10 or 15 minutes at a time, take a little bit of rest and keep moving, because your spine wants to move. It just wants to move in a more stable position. Number 5, watch your sitting. Yeah, sitting. You wouldn't think sitting could mess you up, but when you sit, you load your discs by 300%. That's right, 300%. And in the short term, it might feel good to sit and you're like, I can relax. But what you're doing is you're jamming those discs up and jamming the joints up, and it's creating inflammation and creating pain. In the short term, you might feel better, but long term, you're going to actually have bigger problems on the road. So avoid sitting as much as you can. I also say don't sit on a couch. If you have a couch, just lay down on it. Or if you do have to sit, make sure you get a back with a hard chair and just sit in there very nice and upright, but don't sit for very long. I either want you laying down or I want you standing up. I don't want you sitting, because we don't want to load that disc by 300%. Number 6, take some lay down breaks. Yeah, chill the hell out. Lay down. Laying down really decompresses the disc, takes the pressure off of there. And you'll be like, I don't have time for this. I got all these things to do. Your body doesn't care. Your body's in pain and it's trying to tell you something, and you need to listen to it. So take some breaks, take some lay downs. That's going to really help the back start to heal up, get some of that inflammation out there. Number 7, be patient. Don't panic and listen to the cues. As society, we want to do whatever we can to get out of pain really quick, and we make some really bad decisions in the short term. We end up getting injections and surgeries that we don't need. A lot of times these will get better over time if you do all the things that we talked about. Don't panic. Don't try to stretch it. Don't get treatment for 7 days. Keep moving. Watch your sitting. Lay down and understand that this is going to be a process, but if you can get through this, it's going to get better. But if you start doing that stuff too early, maybe you start stretching it too early, you go to the chiro too early, you go get a massage too early, what you're doing is you're restarting the clock. These usually last anywhere from 7 to 10 days. First 72 hours is usually the worst. So if you go in there and let the body do its thing, then you can go in and get some treatment and get it healed up, and that's going to help you be in a much better place. That's all I got for the video. If you like the video, give it a like, give it a comment, give it a share with someone that you think it might help. Number 2, send in any questions you want me to cover. I love doing these episodes and giving information out there, because at the end of the day, I want to get better care to people and have them be properly educated and informed so they don't go down that horrible path that is the medical nightmare. And lastly, if you're dealing with an injury for more than 3 months, you've seen at least 2 other providers, and you're not getting any better, then it's time to hook up with a Peak Method trained provider. They are the best in the world at finding and fixing problems that other providers can't. And all you got to do is reach out to us wherever you're consuming this video and send us a direct message, and we'll get you set up for a no-charge injury consultation to get you some real answers about what's going on and make sure that these problems don't happen again in the future. Appreciate you guys watching the video, and I will see you on the next one. Bye.